I'm Yogini Jani, I'm Medication Safety Officer at University College Hospitals in London, and my poster is about a seemingly simple issue, self-medication by patients in hospital, yet it seems a challenge that is challenging very many hospitals, certainly in the UK and beyond, I'm sure. So what we're trying to achieve is get patients to self-medicate whilst in hospital. Many of them do this when they're at home anyway, and if they can do this at home, in the hospital, they can get to know their medicines better, continue to keep their routine, and hopefully experience reduced delays and admissions. But what we found when we surveyed some patients is that although 84% of our patients were on pre-admission medicines, 60 of them were self-administering at home. In hospital, only 8 of them were administering themselves. Part of the reason is policy related. So our policy requires that there is a set process that's followed for self-administration by patients in hospital, which requires a medic, a nurse and a pharmacist to sign up so that everyone's aware that the patient is self-administering. Because when dose changes happen, when medication changes happen, the dialogue between the person making the change and the patient is not the norm. So typically people will change the drug chart, the medication will appear from pharmacy, but it's rare during hospitalisation to have that dialogue with the patient to say, we've changed something. So we've got low self-administration rates, and when we asked whether they would like to, we got this 50-50 split almost, where 43% of patients are saying, yes, we want to continue self-administering because it gives us more control. But then we had 44% saying, no, I'm in hospital, I'm unwell, the healthcare professionals know best, and I don't really want to do this. So my challenge is that it seems the right thing to do. There's a set of people who are willing to take this on. As an organisation, we want to support them because we know that an activated patient leads to better outcomes. How do I make it happen on a ward with a mixed economy of some patients getting their own medicines themselves and some with nurse administration, whilst making sure that we don't lead to harm by having that mixed economy. So I'd welcome any views from anyone who's tried this and succeeded in any way, shape or form, but it's something that we keep persevering in trying to take forward. So thank you very much.